I'm Randall Gann, Chief Executive Officer at Missouri Ozarks Community Health. I started back in 2015, so we're coming up on 10 years. It's been a good 10 years. So in the past 10 years as CFO, I've had to increase our controls internally, make sure our grant funds are managed appropriately, increase our grant funds, increase patient service revenue, come up with ideas that are strategic for the organization going forward. So kind of a good mix of organizational, operational pieces as well as financial at the same time. Prior to Missouri Ozarks, I worked at BKD, now 4Viz, for 2 years and just worked with FQHCs. So physical growth may be limited going forward. That's something that we've talked about internally here for a while is, we have stretched out into communities that we think we can stretch out into. We can bring more services though, and that's going to be the focus, is bringing services that people may have to drive to Mountain Home, to Springfield, to West Plains, trying to get some of those services local to avoid the drive time for individuals in these communities. Definitely behavioral health is a huge need, substance use as well. So substance use treatment needs to be a big focus going forward. Some specialty services I'd like to start connecting either via telehealth or with actual providers out here. So that's kind of the focus, is just getting some of those more specialized services to Missouri Ozarks. So the first phase that I'm looking forward to greatly is getting out into the communities and trying to reconnect a lot of those partners and relationships that we may not have enforced or acted upon over the past few years. Obviously COVID set us back in many ways in healthcare, and so kind of reshifting the focus back to what we were doing prior to COVID. So Tim Shrike has been a key piece in healthcare in this area for 40 years. Tim has worked at Missouri Ozarks for almost 12 years now as CEO. Before that, he was COO at Jordan Valley, and before that, he worked at Mercy for almost 20 years. So he's been an exceptional piece in Southwest Missouri for healthcare for almost 40 years. He deserves retirement. He's done a great job, obviously, earned every bit of what he's done here. He took the organization from a small FQHC at the time to now what you see today as 6 clinics and over 15,000 patients. We have probably the most dedicated board and staff members I've ever seen. I mean, our board, some of the members are 20 years plus, some of them are newer, which is a great mix, but our board is dedicated. They come to every meeting. They make an attempt to, come to all of our organizational community events, things like that. And then staff, of course, we have very dedicated staff. Our tenure is really good. A lot of people here, I think, would say Missouri Ozarks is a great place to work. We've done surveys and there's a lot of data to prove that. So very positive work environment and awesome staff. I'd say we're not just healthcare. That's the thing I want people to understand, is we're not just healthcare for the community. We try to be a community resource, community asset for everybody. It's not just about giving you medical care. It's medical, dental, behavioral health. It's linking patients with proper resources. It's collaborating with the schools, collaborating with our partners in the area, working with the health departments, working with the area partners that are focused not just on healthcare, but improving the community overall.